Welcome back to our third and final episode about cancer in 2030, part of this year's CanForum. It's often said that you have to be well to deal with cancer. Ironic, I know, but it speaks to the incredibly tough time that many cancer patients go through as they seek information, diagnosis, and access to the best treatment. We say Australia has patient-centred care, but do we really? Can we do better to incorporate patient preferences and learn more from their experiences? You bet we can, and in this episode, you'll learn how.
Lucas O'Beagley never goes anywhere without a shell from his local beach.
I found the shell on the beach down in Rosebud, and I thought it was so cool. I saw the top of it at first, and then on the other side, it's got like this rainbow effect through it. So the beach is something that I really connect to and something that I really missed during my time in hospital. So having this shell, I keep the shell in my bag that I take everywhere. So it's a bit of the beach that I take with me.
Lucas spent just over a year in and out of hospital being treated for a Germinoma brain tumour and a flesh-eating bug. He was barely 18. And with his immune system so depleted from the chemo, he almost died from an infection that got into his bloodstream.
Yeah, to the point where my own mum, my grandmother and my mum organised a priest to come and do a blessing for me, almost like a final blessing, because they didn't know how the treatment was going to go from then on.
He's grateful, of course, for the care he received. But it wasn't perfect. Too often he felt his doctors were more interested in the cancer than in him.
So I'm in a bit of a sort of anxious and vulnerable position in that, and then I hear them outside my door saying, he's a Germinoma brain tumour, blah, 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 blah. Not saying my name, really, not introducing me by name, talking about me outside the door where I can clearly hear them. There's at least 7 of them standing outside the door, and they're referring to me as Germinoma brain tumour.
To Lucas, the cancer was at the centre of everything.
I didn't really feel like they took into consideration that there's an 18-year-old in an adult hospital who's actually living with it and actually having to manage, thoughts and emotions and feelings about all of that. Sometimes I would say, not feeling amazing at the moment. They go, keep at it. And that was it. Yeah.
That's really important because it's the patient who knows the best how they feel.
Professor Rachael Morton knows the value of treating patients, not diseases. She works with data from patient surveys that captures how they're feeling about their treatment experiences and their quality of life.
It's self-reported data. So it's thoughts, feelings, emotions that come directly from patients without interpretation of that data by anybody else. So without interpretation from the patient's nurse or cancer doctor.
Such data has been used in research for the last few decades, but using it in real time, like filling out a survey shortly before seeing your doctor, is pretty new.
It helps signal when there's a real problem. So whether somebody's in distress, whether somebody has intense pain, and sometimes things that patients don't always volunteer in a consultation when they see their busy doctor. But the other thing is it can show how people are going sort of over time. So, every 6 weeks or every 3 months, it allows a doctor or a nurse to see how somebody's tracking. Are things getting better or getting worse?
Lucas was never asked to fill out any surveys. His doctors focused on the other data.
The objective data, so the blood test results and the CT scans or PET scans, because they provided sort of evidence of whether the disease was progressing or regressing. However, now people are much more aware that in order to live a good life either with cancer or after cancer, you need to be paying attention to some of these other factors. And so they're starting to be given more equal weighting.
That's good news, but does this type of data also make a difference to life expectancy?
Yeah, that's a really good question. There have been a couple of clinical trials, and there was one landmark trial by Ethan Bask and colleagues in the US, and that was the first randomised trial to show that for patients having chemotherapy, if they had reported their symptoms and then they had their symptoms acted upon, they not only improved their overall quality of life, but they also lived longer. And everyone took notice of this when it was presented at the big cancer conference. And since then, people have started to replicate these findings in other areas.
By 2030, Professor Morton wants all cancer patients filling out surveys throughout their cancer journey, and for that information to be used in real time.
To see it openly discussed with patients in their meetings with their doctors and healthcare professionals, and then, treatment done accordingly. I'd also like to see, health systems be funded and rated on their ability to take into account this information.
It's about really putting patients at the centre of cancer care. Something Australia does already, doesn't it?
The patients that we speak to daily, they will tell you that we don't.
Dr. Amanda Ruth is the author of Vision 2030, a report that recommends effectively and consistently delivering on what is important to patients.
They don't necessarily feel like they have the right information or tools to convey how they feel, what they need, and what they need to make the right decision for them. And they want to have the option of making decisions about, do I want to stay on this therapy? Do I want to experience side effects? Is quality of life important to me? Because quality of life on a particular therapy and not experiencing side effects may be more important to one person and less important to another. They might be focused on longer term survival. So I think it's also a unique experience, and patients need to be heard and considered in these decisions.
Anne Single agrees. She says cancer treatments are often subsidised by governments off the back of clinical trial data, but that data doesn't reflect real-world experience.
So when you see outcomes from a clinical trial, you might see something like overall survival might be measured, and that's really important, obviously. But you might not see that, this treatment, for example, patients are actually getting a better night's sleep. Things like getting a good night's sleep and not having fatigue can be really, really important to patients, but they're not necessarily the things we measure in clinical trials.
Every patient sees the balance between quality of life and extended survival differently. Patient surveys can measure that difference, and Anne wants that taken into account whenever new treatments are being developed.
We're trying to get what matters to patients into the research and development. So by the time it actually comes to a government to assess whether something's good value, we already know what matters to the patients. It's captured there in the trials. You don't need to have consensus. Every patient doesn't have to want the same thing for a government to fund it. What they need to know is which patients, so they can work out some numbers, and under what circumstances, so that they can always manage the quality of the treatment.
Hey, want to say hi?
Jelena Magic would love her younger son Marko's latest cancer treatment to be funded by government, but it isn't. Marko was diagnosed with a rare neuroblastoma at just 16 months of age. Now, at age 3.5, he's had surgery, chemo and radiotherapy, a stem cell transplant and immunotherapy. He's now on a clinical trial for a vaccine as a measure to prevent a relapse.
Despite all this, we may still lose him, and that's every parent's worst nightmare. You just feel absolutely helpless.
Marko has to travel to the United States to receive the vaccine, because that's where the clinical trial is taking place. And it was Jelena and her husband who raised this option, not Marko's doctors.
We suggested this option to them. When we spoke to our oncologist, he was already familiar with it because there was another patient of his who was at the time undergoing trial, and he was supportive. What they did say is they would love to have this option available in Australia, but at the time it was not possible to bring the drug, and it was mainly due to commercial and legal reasons. So they were supportive of us pursuing the option, but unfortunately could not really assist in any practical way.
So Jelena had to turn to crowdfunding to pay for travel and accommodation expenses, and must now risk her vulnerable child's life in a country rife with coronavirus.
There is no right or wrong answer here. You pretty much have to choose the lesser of two evils.
By 2030, cancer experts hope such choices won't be necessary. Instead, they want many more clinical trials to be taking place in Australia. That will take a lot of investment. But as the advent of genetic sequencing turns cancers once thought of as common into rare, the opportunities to develop more drugs through clinical trials will explode.
Godzilla here.
Where is Godzilla? Yeah, it's over there.
Have a look at Godzilla.
Do you like your Godzilla?
In the meantime, though, Jelena must get on a plane. At least she knows that paying top dollar in the private hospital in New York will mean dedicated care.
Now, don't get me wrong, care that we've been receiving here has been great. Our clinicians have been very supportive, but at times it did feel like we were on a conveyor belt. And it's not due to the lack of caring, but just that hospital appointments and interventions are organized in such a way that that person-centered approach does not shine through. And that's one of the areas we'd like to see changed.
Lucas O'Beagley knows cancer patients have great reserves of inner strength.
Trust yourself. Like you can handle a lot more than you believe you can.
But he says doctors still need to be trained to see the person and not the disease.
It's such a difficult thing to be faced with, and you need people who are understanding and supportive, especially at the very beginning. And if you don't have that, then it can be very difficult to even engage with medical professionals if you don't feel like they've got your best interests at heart.
For Anne Single, the future is about validating and funding what patients already know matters to them.
And I would like us not to have to be having this same discussion about, there's not enough evidence around rare treatments or very innovative treatments. We've known that for nearly 20 years now. So in 10 years' time, I really hope we've worked out different pathways so that we're not still talking about that.
But for that to happen, we need better mechanisms to collect, share, and make sense of patient experiences.
Yeah, I think the infrastructure required is probably more than people had thought, and you're having to work with existing hospital pathways and processes. So that sort of IT system and infrastructure also needs to be built, and that's actually part of the difficult part of the process.
Let's see what can be done right now to meet the needs of each individual patient with all their health, mental health, economic, social, emotional needs, and maximize their opportunities of surviving and thriving.
So there you have it, a vision for what cancer diagnosis, treatment and care can and should look like in Australia by the year 2030. Over the last 3 episodes, we've shown you the future, one in which emerging therapies and personalised medicine revolutionise the way cancer is treated. A world where big data connects patients with the right therapies according to the specific genetic makeup of their cancer. And an Australia in which patients truly are at the centre of our care. This vision, while exciting, will take a lot of work. We need to move now. We must grasp the opportunities with both hands. The future is in sight, and it's one in which tens of thousands of Australian lives are saved from cancer. That's the future we want.